So we've entered Hushabye Nursery. We are a NAS center for babies that are recovering from the substances that they were exposed to prenatally, most commonly opiates. So when they're going through that withdrawal process, we have 12 private nurseries where the babies can come, all quiet, dim lighting. We have it where the families can stay 24/7, and that really is our goal. Babies, it's been proven, go through that withdrawal process easier if their families are able to be here. So we really encourage them to be here. If they're not healthy enough, if they can't because they have other kids, it is okay. But we have the opportunity for the families to be here. We have the Mama-Roo, a snoo in every room for the babies to be able to, calm them if our hands aren't doing the trick. We have one-to-one caregivers on site. We have registered nurses, patient care assistants, volunteers that are all trained for about, I think it's 16 to 20 hours of training for the volunteers. I'm Tara Sundum. I'm the executive director and founder of Hushabye Nursery. We are a recovery center for babies withdrawing from the substances that their moms were taking while pregnant. So babies diagnosed with neonatal abstinence syndrome. We also provide family-centered care, making sure that we're providing wraparound services starting prenatally and continue postpartum. So yes, we are working with the babies, and we're specifically, that's how we were designed to be a center for excellence for these babies. But we also meet the families where they're at, whether that be prenatally and they're struggling, or maybe they've been in recovery for years and are being treated with medication-assisted treatment. We will meet them wherever they're at and help prepare them and empower them with that education for what it's going to look like when their baby withdraws. What can they do to make it easier? Connect them with services to help them succeed. We have cared for 92 babies and their moms and dads so far. We're working actively with 72 pregnant moms and their significant others if they're involved. We have 85% of our moms and babies that are active in our prenatal program. If they're working with us prenatally at the time of delivery, we're able to keep those families safe and together. And so our program is focused on the baby, but it really, the program are those wraparound services, truly making the family healthy. The mom and the dad, working with them prenatally to get them into treatment, whatever that is, helping with housing, food, transportation, intensive outpatient therapy, whatever that is, working with their families to mend relationships. We're here. We have trauma support specialists, we have marriage and family therapists on site, we have a case manager that specifically works with Department of Child Safety. Used to work for DCS. Now she works with our families and goes to court with them, does their team decision-making meetings with them, makes sure that they understand what's being asked for them. If I have a mom that comes in and she's not to her happy dose, we're connecting with them there, we're calling their provider, we're saying, okay, she's not using 18 times a day now, we're down to 14, but she's still waking up in the middle of the night and she's sick. Many times the provider will go, well, she didn't say that to me. Well, darn it, you just haven't built that trust, because she's feeling comfortable enough for me to tell me that she needs that. And that's what's a little bit different, to collaborate with all of us. So with the obstetrician, with the pediatrician, with the recovery specialist, whoever, the MAT clinics, that takes time. It does. It's not hard, but it takes time. And Hushabye has that with our peer supports, with our case managers. We do that. We have two peer supports right now that went through our program. I met them pregnant, scared to death. Both of them really pretty much succeeding in recovery, but being prescribed medication-assisted treatment, so methadone. Their babies were going to withdraw. They have had their babies went through withdrawals. Were they trained on what needed to be done to make withdrawal a little bit easier? Were they encouraged and empowered by education? They knew that they could breastfeed. They knew that it was recommended for them to breastfeed. They had research, they had studies to be able to show their providers that, guess what, I'm a really good mom. Yes, I have a history. Yes, I've made bad choices in the past. And sometimes we're still making bad choices, but with these two mommies, they are now our peer supports here at Hushabye. They're now trained as doulas. The impact that they're making by having that lived experience, something I don't have that. I have never met a mom that doesn't love her baby, ever. They may not be well enough to care for their baby, or it may not appear that they care for their baby because they're so sick. If you give them support, you can get there. But Hushabye's here if you need us. I promise, if we don't have the service, if we don't know who it is, pretty sure we know somebody that knows somebody that knows somebody that can get a family help. If they're coming to you, they picked up the phone, gosh, that took a lot. And then we have healthy families, so it's worth it.